So let's discuss about the management. It mainly depends on the symptoms of the patient. In asymptomatic conditions, we just do expectant management, which is watchful waiting. So what are the conditions where you are completely asymptomatic but still have to get treated? 1. Large fibroids which have symptoms in the near future. 2. Multiple fibroids. 3. The fibroids causing subfertility or infertility or repeated abortions. 4. The fibroids which grow rapidly in size. 5. The fibroids which show change in their nature, like turning into cancer. So this brings us to a question that, are fibroids cancerous? The majority of fibroids are not cancerous, they are benign tumors. Rarely they can turn into cancer, like they have 0.5% chance. The medical management for fibroids can be divided into two types, where one deals with the decrease in menstrual flow, 2 decreases the bulk of the fibroid. The medical management of fibroids include oral contraceptive pills and pills to reduce bleeding like tranexamic acid, and also progestin intrauterine devices, like we have to place it in the uterus. There are GnRH analogs like Fibroid and also newer drugs which are selective progesterone receptor modulators like ulipristal. Other minimal invasive procedures for fibroid include uterine artery embolization, wherein you block the artery vessel supplying the uterus with gel foam or polyvinyl alcohol so that the fibroid shrinks in size. It gives almost 40 to 50% of shrinkage. 2. You can also do a magnetic resonance guided focused ultrasound for shrinkage of the fibroid, and also radiofrequency. But all of these have limited studies. The treatment of choice would be surgical management for patients presenting with symptoms and also with huge fibroids. For example, the other day we had a patient, 27-year-old woman, presented with a huge fibroid. She did not have any symptoms, but only one, which is retention of urine. So this is the MRI of the patient, where you can see the fibroid occupying the entire lower abdomen of the patient. The fibroid is compressing the large bowel and also the bladder, causing her symptoms. We have thoroughly examined and evaluated the patient and successfully removed the fibroid laparoscopically with 4 small incisions. This is another patient presenting with infertility, 31-year-old, with multiple fibroids of different positions and also an ovarian cyst, for which laparoscopy and hysteroscopy was done. So what happens if you get conceived with the fibroid? As such, pregnancy does not have any effect on the fibroid. Some fibroids may increase in size or some may decrease in size, but some may increase in size and also have degeneration, causing pain and fever in second trimester, where you have to go consult your gynecologist immediately. Another popular question from mothers who get conceived with fibroid is, can I get it removed during Caesarian section? But I would suggest no, because the average blood loss in Caesarian section is 1 liter, which is just enough to cope up. But if you attempt to remove the fibroid during Caesarian section, it will cause more bleeding and is not recommended. So if you have any symptoms mentioned earlier, or you are completely asymptomatic but come under the category of risk factors, please do consult a qualified gynecologist and get yourself evaluated. Laparoscopy for removal of fibroids is a safe procedure which is minimally invasive, and the patient gets discharged the next day with minimal recovery time. Make sure that you get a consultation with a trained laparoscopic surgeon, gynecologist, for the treatment. If you have more doubts, please write in the comment section, and do share this video with female friends to spread awareness. Do subscribe to our channel and hit the bell icon to get more informative videos.